Hello Tracy.
Hi.
Hi. So we're meeting today right at the end of January, just after our last public board meeting. So what struck you about the board meeting yesterday?
It was a really good day. I think the most powerful bit of the board, as it often is, was the patient story at the beginning, and we were joined by a patient's carer, husband of 54 years I think, and some of the team at the inpatient ward where Mr Draper's wife Anne had been looked after more than a year ago now, and for a whole variety of reasons we'd really let Anne and Mr Draper down in terms of the care that we provided, and it was a great opportunity to hear not really what had gone wrong, but hear from the ward team and the wider organisation the learning we've taken out of that, and to hear how confident Mr Draper was that if Anne needs care in our services again in the future, he will now be confident that she would be well looked after. The real theme about it, as is often the case, is that this was unfortunately another example of where people failed to see through our policies to the person that they were caring for, and people didn't understand what our policies said was the first problem, but they weren't then thinking, okay, this patient doesn't fit into our policies, do we need to escalate this and think about how we can work outside our policies safely to give the patient what they need? In fact, what happened was policy says no, computer says no, and that was really disappointing, because we've learned, and most of the time, most of our colleagues do an amazing job at thinking about what is the real issue here, what do the policies say, how do I get the right thing done for this person, rather than just doing whatever a policy says. Clearly there's been great learning, but it's something that we've got to keep working on and keep reminding ourselves, whether it's how we deal with each other in the organisation or how we deal with our patients and their families. Policies and frameworks, guidance is there for a reason, but actually we can't get lost in those and miss the real trick, which is supporting somebody through their issues or their problems.
Definitely, and it was really evident actually, because some of the team from the ward were there.
Yeah.
How they made that relationship really work well.
Absolutely.
With Mr. Draper. One of the concerns the board had was also, so well done that team.
Yeah.
How do we share that with the other teams to make sure they're also learning from that?
Yeah.
I think there was some
There
work
was
to
quite
do.
a lot, wasn't there, about sharing across networks with matrons, ward sisters, making sure our policies are adapted wherever they need to be. We just need to keep working on it.
Yeah. Now, one of the other things we talked about at board, and I know it's embargoed so you can't say much, was the staff survey. Yeah,
so we've had the very first set of kind of headline results to the staff survey. Not allowed to share them publicly for another month or so, but some key headlines that we can talk about. First thing is a huge thank you, because more people than we've had before chose to take the time to fill it in. So we had a response rate of more, I think it was 61-62%, which is fantastic. The more we talk about the things that are going well, the things that aren't, the more we can all work together to solve them. The other big headlines were a big increase in the number of people saying that they feel this is a great place to work, highest that we've ever had actually, and we know it's all wrapped up in our vision in the DCHS way, that if we enjoy coming to work and we feel supported, looked after, developed, that translates to great quality. So that's why that's important to me. And a big increase in people recommending the place as somewhere that they would be happy for themselves or their family to be treated. Again, a great indicator of quality. Improvements in things that where we've been doing some work on the back of last year, people feeling that their well-being and their health is taken seriously and they're supported with that effectively. Around a link right through the organisation into people's appraisals about the values that we expect of each other in DCHS. Really disappointing dip in people talking about, despite that, the number of people who've had a good appraisal, and we know we've seen that this year through the board performance reporting, so we know we've got work to do on that. And the other area that was a concern last year remains a concern, so we had a challenging conversation at board about what else we can do, is the number of people who are still at risk through managing violence and aggression in particular clinical areas, mainly obviously our learning disability and OPMH services. So I think that will continue to be a focus going forward.
Definitely. Michelle was talking about some initiatives in those areas to help with that, which is great. So more to hear about that. Middle of February, I think, is when they unembargoed, and then people get to see relevant stuff for them. We also talked about winter pressures, flow, those kind of things, and we've got a visit.
Yeah, I mean, it's exceptionally mild today, but levels of demand are staying high. Flu seems to have peaked, and I'll talk about flu again in a minute. There is a real national focus now on community services and the role we play in managing flow through a system, preventing admission at a kind of crisis point where we can, and then getting people out of hospital when they no longer need that support. The Getting It Right First Time, GIRF, national programme, which has been focused on acute hospitals up until now, is now changing its focus to look at how can community services do the very best, most effectively on that flow. And we've been chosen for one of the initial national visits. So Professor Briggs, who manages it nationally, and an august team are coming to visit us towards the end of February to look at how we're working. I think it's a great opportunity for us to share some really good practice, and I'm also hopeful that we will get challenged and inspired and learn from other people about some of the things we might be able to do better.
And I think it'll cover not only our inpatient setting but at the community
Absolutely.
as well, and some of our specialist conditions as well.
Absolutely.
So I think there's a focus on respiratory conditions.
Yeah, you're right.
Lots to follow there. You mentioned you come back to flu.
Yeah, well, I mean, I just wanted to mention briefly, obviously there's an awful lot in the news about coronavirus. And I wanted to just let everybody know that we are well engaged with the national planning through the NHS on preparing for cases of coronavirus in the UK. So our urgent treatment centres, GP practices, have all got the right information, understand what they need to do should somebody pitch up with those symptoms. And that stuff is incredibly important because obviously we don't have a vaccine yet for coronavirus. The link I wanted to make was that in the case of flu we do, and it's absolutely fantastic that more than 80% of us have chosen this year to have that flu vaccine, protect ourselves, our families, our patients and each other from flu. We've achieved the highest level ever. We've donated more than 9,000 vaccines to kids in developing countries to protect their health, and it gives me enormous comfort to know how importantly everybody in DCHS is taking that patient safety initiative. I hope it gives the rest of the community that assurance, and I hope that we don't see all that effort with flu kind of undone by a difficult time with coronavirus. But at the moment things seem really, really well controlled. And as I'm doing this, we haven't yet had a confirmed case in the UK.
Yeah, and actually the exec with oversight for our flu protection campaign was the split between Michelle and Amanda. And it was Amanda's last public meeting, wasn't it?
It was. People will know that Amanda's leaving the organisation at the end of next month, and obviously Jen, her dep, is going on maternity leave at the same time. We're going to be doing an awful lot to thank Amanda and give her a brilliant send-off over the next month, but we did take the opportunity at board to say publicly a little bit about what an enormous contribution she's made. She's going to be a great loss, but actually she's continuing to work in the Derbyshire system, which is brilliant for us. We've got a fabulous people services team, very, very confident that they're going to be able to keep going without Amanda and Jen. We've made 2 great interim appointments, an interim director and a deputy who are joining us over the next few weeks. There'll be some comms out about that next week. People from People Services were involved in that, and I think that will just make sure that we're not going to drop any balls whilst the team keep going and we work on securing a worthy successor for Amanda and Jen.
And as you say, it's not that she's going far, she's just
over
the road and part of the system team.
Absolutely.
So, well, thank you very much for your time,
thank you,
Tracy, and we'll have another one in a month's time probably.
Brilliant.